According to a recent survey that was done by the Kaiser Family Foundation, 59% of people on Medicare Advantage plans, they have an HMO. But do these plans actually pick your doctors for you? Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help seniors navigate the Medicare maze. So in today's short video, I'm explaining the differences between an HMO and a PPO. And we're going to go over three basic topics. So number one is, what exactly is an HMO? Number two, what is a PPO? And then thirdly, we're going to do a side-by-side comparison, go over pros and cons of each so that you can decide which one of these plans is best for you. And that's all coming up next. So what exactly is an HMO? Well, according to healthcare.gov, an HMO, which is a health maintenance organization, is defined as a network or organization that provides health insurance coverage for a monthly or annual fee. An HMO is made up of a group of medical insurance providers that limit your coverage to medical care provided through doctors and other providers who are under contract with the HMO. So what the heck does that mean? Well, what that means is when you have an HMO, you have got to stay in the network of contracted providers in that plan. If you go out of the network, if you go to a doctor or a hospital that is not under contract with the HMO, you have to pay all costs associated with the service. You have no coverage. So simply said, in an HMO, you have a set group of doctors and hospitals that you must stay within if you want to be covered for the contracted negotiated price. So do these HMOs actually pick your doctors? Well, HMOs don't pick your doctors. You just have to stay within the group of doctors in the plan. So when you're shopping for a Medicare HMO, what we do with our clients is we go through the entire list of your providers and we look up each one individually, and we only pick plans for our clients where all of the doctors are participating in that network. Now, there is one caveat to this, and that is that sometimes these contracts can end mid-year. So we have had instances where a doctor was in a network, and then during the middle of the year, they pulled out, and the client could no longer go to that doctor because they were no longer in the HMO. But HMOs certainly don't pick your doctors for you. You could go to any doctor that is in that network that's contracted with the HMO. Now, what you guys might be thinking is, well, what if an emergency happens out of state? Well, no worries there. If you're out of state or you're out of the service area, you're always covered for emergency. So it doesn't matter where you are in the U.S. If you go to a hospital, the ER, or urgent care, you're going to be covered for the same copay as if you were in your own home state. Another characteristic that is common with HMOs is that most HMOs do require referrals to see other doctors, like specialists. Although in Ohio, most of the HMOs are now doing away with that, as most Medicare Advantage plans you'll see in the guide, they do not require referrals. Now, even though they don't require referrals, you will still be required to pick a primary care doctor when you enroll in an HMO. So what about PPOs? Well, PPO is a preferred provider organization, and according to healthcare.gov, is defined as a type of health plan that contracts with medical providers, such as hospitals and doctors, to create a network of participating providers. But you pay less if you use the providers that belong to the plan's network, and you can go outside of that contracted network. So if you go outside the network, you're still covered, but it is likely that you're going to pay more for that given service. So I don't give my clients PPOs and encourage them to go out of network, because often you have a deductible to go out of network, and you're going to pay a higher co-insurance for not being in the network. So again, I wouldn't say, hey, take a PPO and just go wherever you want, because you're going to end up paying more. But Where this could come into play and could really be helpful is if your doctor leaves the network, or if you're diagnosed with like a rare condition, or perhaps a condition where there's a specialized doctor out of your state that you want to go to. So think of, if you had a rare form of cancer and you lived in Ohio and the number one doctor for that type of cancer was in Kentucky, on a PPO, you would be able to go to that doctor, okay? You would be covered, but you would pay slightly more than had you stayed in the network in Ohio. Whereas on an HMO, you could not go to that doctor in Kentucky. You would have no coverage at all. And another characteristic of PPOs is that you do not need to select a primary care doctor. And on PPOs, you do not need referrals for specialists and different healthcare providers. So the question everybody wants to know is, well, then which is better? What is actually a better plan, an HMO or a PPO? So let's put these plans side by side and compare. So on an HMO, you are typically going to have lower copays, you're going to have lower monthly premiums, and you're going to have lower out-of-pocket costs. Conversely, on a PPO, you're going to have slightly higher copays and higher out-of-pocket limits than had you taken an HMO. We've also noticed that HMOs tend to have better extra benefits on Medicare. You're going to get more dental, more vision, more over-the-counter supplies, and more of the extra benefits that are offered in Part C plans. Now, when it comes to flexibility in choosing doctors, on an HMO, you are going to have a much smaller selection of doctors because you have to stay in that contracted group of doctors. You cannot go outside. Where on a PPO, you're going to have a network, but you're also going to be able to go outside of that network and receive care. So when it comes to access to care, access to doctors, the PPO is certainly going to have the HMO beat. And on HMOs, there is a chance that you're going to have to receive referrals to go to different doctors. So if you want to go to a neurologist, or you want to go to a cardiologist, you're going to have to get referred from your primary care doctor. Now, this is not always the case, but on some, even most HMOs, that is the case. Whereas on a PPO, you are not going to have that concern. You don't even have to have a primary care doctor, let alone be referred to see other specialists. So my personal opinion on HMO versus PPO, it comes down to the individual. Look, if what is important to you is to be able to go anywhere you want and receive coverage, then a PPO is going to give you that value, and it's going to give you the coverage that you need. Whereas if the things that are important to you are the copays, keeping your out-of-pocket costs lower, and receiving the maximum amount of extra benefits, at least in 2023, you are going to receive more benefits and lower copays on an HMO. And along with the stat I gave at the beginning of the video, 59% of people do HMOs. When we compare that to our clients, it's actually, from what we see at LMS, it's probably more 4-to-1 here for the people we work with. For every 5 people we enroll, 4 out of 5 are choosing an HMO. Now, a real story, I had a client call me. She was on an HMO in Ohio, and she had been diagnosed with cancer at the end of open enrollment 2022. So she called me to see what she could do. I explained to her, I could put you on a PPO. You're going to have higher out-of-pocket limits. You're going to have higher copays. But if anything happens and you need to be sent elsewhere for treatment, you can go. If you need to go to Minnesota because they have, one of the best cancer programs in the world, you can go. And that gave my client peace of mind. So she changed from an HMO to a PPO just so she had the peace of mind of knowing she can go anywhere she wanted to receive care. So I think both of these plans do serve a purpose, and to each their own. But hey, that's why we're here at LMS Insurance Group. we work with individuals on a one-on-one basis. You're not just another number. We will analyze your entire situation and we lay all the options out for you. So by all means, if you need our help, go ahead and hit that number at the bottom of the screen and you'll work with me or one of our Medicare experts in my office, as we will always give you the forthright information and tell you the pros and cons to each side. So I hope this video was helpful. If it was, go ahead, give it a like, give it a share. That's what helps this channel grow and get this message to others that would find it helpful. Thanks for watching. I'll talk to you guys next time. Larry Goist, LMS Insurance Group.